NUR 612 Final Exam Actual Exam Newest 2026-2027 Actual Exam with complete 100 questions and correct detailed answers. Question 1. PG1. NUR 612 Final Exam Actual Exam Newest 2026-2027. Actual Exam with complete 100 questions and correct detailed answers, verified answers, already, graded A+. A 21-year-old female Division I soccer player comes into urgent care C/A right knee pain and swelling. She states that at practice 4 days ago she heard a pop and had an immediate onset of pain. Since the injury she has noticed her knee is really unstable and is constantly giving out on her when walking to class. On exam you notice she has a bent knee gait, positive Lockman's maneuver and a palatable patella. What is her DX? MCL tier, ACL tier, LCL tier, PCL tier. B. ACL tier. Question 2. T/F. MRI is the confirmatory test for ACL and PCL injuries. True. False. True. Question 3. A 21-year-old female Division I soccer player comes into urgent care C/A right knee pain and swelling. She states that at practice 4 days ago she heard a pop and had an immediate onset of pain. Since the injury she has noticed her knee is really unstable and is constantly giving out on her when walking to class. On exam you notice she has a bent knee gait, PG2, positive Lockman's maneuver and a palatable patella. What should you do for this point? NSAIDs, splint and F/U in 2 weeks. Order MRI, immobilize and refer. Send to ER for emergency surgery. Straight leg cast for 4 weeks then F/U with ortho. B. To order MRI, immobilize and refer. Question 4. A 68-year-old female presents to the clinic C/O left knee pain. She states that she was walking in her house 2 weeks ago and felt a pop in her knee and had an onset of knee pain. She states the pain has been persistent and her knee occasionally gives out, but feels like she can do most of her daily activities just fine. On P she has a positive anterior drawer and pivot test and tenderness on the joint line. What would you likely do for this point? Conservative treatment. Schedule for surgery. Emergency surgery. A. Conservative treatment. Question 5. A 34-year-old female presents to the clinic with C/A right knee pain. She tells you that she was in a high-speed MVC 2 weeks ago where she incurred multiple injuries and was admitted for 3 days. She had the knee pain at the time of the accident, but was referred to the ortho office after discharge. She states that the pain has improved but she has a lot of instability with ambulation. On exam she has a negative anterior drawer, PG3, a positive posterior drawer and a sag sign. What are you most concerned? 4. MCL tier, ACL tier, LCL tier, PCL tier. D. PCL tier. Question 6. A 67-year-old male comes in C/A right knee pain that has been progressively worsening over the past 8 months. States that the pain is the worse when he tries to go up and down stairs or stand up from sitting in a chair. What compartment would you expect to find abnormalities on X-ray? Medial compartment, lateral compartment, patellofemoral joint. C. Patellofemoral joint. Question 7. What is the special test used to assess the calcaneofibular ligament? Taylor tilt inversion. Taylor tilt inversion. Question 8. If a student athlete has a possible ATF sprain, what is a special test to see if it is sprained or not? Anterior drawer test. Anterior drawer test. Question 9. Another term for the anterior tibiofibular ligament is syndesmosis or interosseous membrane. Syndesmosis or interosseous membrane. Question 10. PG4. Which test do you use to help identify tibiofibular syndesmotic injuries? Squeeze test. Squeeze test. Question 11. A school-aged child has a fractured wrist with a Salter-Harris type 2 fracture, according to the radiologist. What is true about this type of fracture? Growth disturbance of the long bones of the arm is likely. There is a metaphyseal fragment on the compression side of the fracture. There is usually a compression or crushing injury to the physes. This will require anatomic reduction using open approach. B. There is a metaphyseal fragment on the compression side of the fracture. Question 12. A 14-year-old boy who is overweight develops a unilateral limp with pain in the hip and knee on the affected side. An exam reveals external rotation of the hip when flexed and pain associated with attempts to rotate the hip internally. What is most important initially when managing this child's condition? Place the child on crutches or in a wheelchair to prevent weight bearing. Provide information on weight loss to minimize injury. Recommend orthopedic specialist ASAP. Refer to point to improve ROM. A. Place the child on crutches or in a wheelchair to prevent weight bearing.